This is the summer of 2021, and two brothers are discussing the situation with COVID.
Christian, it seems like it might be a good idea for you to get vaccinated considering who is getting COVID in the growing fourth wave.
Tim will consider thanks.
Just thinking about your well being,
Thanks.
you're going to need it just to hang out in Starbucks.
Doing it for that reason or for convenience is not a good idea. Or even falling into line to follow a large group of like minded people. It is about personal choice on the risk you are willing to take either way. There is no right or wrong, just a choice.
So, are you getting the vaccine?
Just so I can go to Starbucks?
Primarily to keep yourself out of the hospital.
I see. Are you worried about me or you in regards to that? 716 unalives per million in Canada from COVID, 0.0007%. Maybe it will be me. The chance of passing in a car accident is 1 in 5,000, 0.0002%.
Think of a vaccine like wearing a seatbelt when you drive your car. I don't know the stats, but the chance of being in a car accident is much greater than the chance of unaliving in a car crash. Wearing a seatbelt or a reduces the chance of unaliving or serious injury if you get in an accident driving. Do you wear a seatbelt? Note as well, the rate off unaliving from COVID per capita has been reduced dramatically by people getting vaccines, so it's not comparable.
Interesting. You cannot compare that to with or without vaccine. An unaliving rate of 0.007% with COVID and the unclear risk of having the vaccine, yes, it is low but not zero, are not different enough like with the seatbelt. I told you I am not anti vaccine, only balancing risk. I will take the risk from COVID versus the risk from the vaccine now. I also disagree when the government is going to tell me what is good for me in a situation like this, and I will not do it because it is convenient. If it was Ebola, that would be a different story. We can talk again when they start telling you you need to have a third, fourth, and fifth dose due to the mutation.
If you have been following the news, you will know the vast majority of people getting COVID now are unvaccinated. And of those who end up in a hospital with serious implications, an even greater percent of those are unvaccinated.
News, not news. Get me a link to the raw data and I will look too. You are incorrect about the vast majority of vaccinated people not having COVID. COVID is everywhere, and the vaccinated people will carry it but may not show symptoms, as obviously this virus will be mutating among the vaccinated people and then become resistant to that vaccine, just as you must get a new flu shot all the time because to mutation. Maybe you do get the flu shot every year. I don't and do not want to. The news report that 80% PF, the COVID complications, are with unvaccinated people. If that is correct, you realize that means that 2 out of 10 in the hospital are vaccinated. That is a terrible ad for vaccination. If we consider that 0.007% will pass, that means that among a family of 10, 0.007 of the group will have a problem. Because the 60 plus are 56% of the hospitalizations and 93% of the passings, a family with everyone under 60 is very unlikely to have a problem. It sounds like you are worried that I may take up hospital space because of my perceived bad behavior, but I will take that risk and feel it is my choice to make. At those odds, you might as well get the government to stop people from voting since the risk of unaliving there is not much lower. Look it up. Because the risk is so low to more than 99% of the population, the government should have taken the billions of dollars it spent on vaccines and used it to beef up the hospital system. They had 2 years to do that. Now you have Trudeau spending billions to secure future vaccines. Who do you think is happy to promote the need for that?
Were you involved in the recent anti vax rally at the hospital?
Nope, I was not. Why? I think it was not necessarily anti vax. Maybe anti vaccine passport. And since you asked, I might add that there are usually the fringe people in any group that will do stupid things. The world is not black and white, and while it generates good news bites to promote the narrative that all the people against this vaccine are anti vaxxers and inconsiderate losers, the majority of the people I know that are choosing not to vaccinate on this one are thoughtful and logical thinkers. You should be willing to question your choices just as I am willing to question mine. Some things I am pretty sure of. One, the vaccinated still carry COVID, maybe will show less symptoms. We all carry it, and the virus will mutate and come back to affect more and more vaccinated people. Two, for that reason, it is not logical to think that a vaccine passport is going to protect the vaccinated. It is actually more dangerous for vaccinated with the false sense of security. 3, if the protection is great, then vaccinated people should not worry about the apparently small percentage of people who are not vaccinated. 4, the unvaccinated people are mostly just people like me. They are not extremist or even, again, vaccines. Just this one, they may even be vaccinated but do not support a vaccine passport. Ask yourself why the COVID numbers are increasing so much in the middle of summer when the weather is warm and vitamin D is prevalent and people are outside more. If 85% of the population is vaccinated, how can the numbers be so high? It is not just vaccinated people that are contributing to the increased cases. I think it is reasonable for anyone to question anything you are told. Actually, you should do that as you are a critical thinker. That does not mean you have to disregard science or blindly disagree. There you go.
Sorry, I was just trying to be funny. I understand your position. Be safe. Yes, vaccinated people can get COVID potentially as easy as unvaccinated people. The differential, however, is that when the unvaccinated get it, there is some fairly good medical evidence that they are the ones who get it bad. I don't feel any safer because I have gotten the vaccine. I just feel that I may be better off if I did get COVID. We still keep pretty much to ourselves and close friends and family as our primary protection from getting COVID. The vaccination is really just like the protection wearing a seatbelt might yield in the event of a crash. Whatever you do, I hope you and your family stay safe. You are the only brother I have, and your kids are my only relatives other than you.
Tim, appreciate the concern. In your seatbelt analogy, the crashes are all quit bad crashes. In current scenario, the COVID crashes are for the most part fender benders where the seatbelt would have less impact. Also, we might consider the seatbelt when it first came out as just a lap belt. It was much less protective like that. You may remember the guy who unalived in Dad's plane crash when his lap belt giving him internal injuries. Perhaps you might liken the vaccine to an early attempt at the seatbelt. I am sure the first versions were not that great. However, this situation is entirely different as it is not about using a piece of external equipment, it is about putting something inside you. Hopefully, you see why some do not want to do that.
It is now October, and it seems like the COVID variants are hitting the unvaccinated harder and more of cases are getting passed on by school age kids. Worried about you with a young kid in school and being unvaccinated. Hope you and your family are all okay.
Tim, the Delta variant is hitting the vaccinated harder and harder. You will notice that the ratio of vaccinated the ICU is higher than when we last talked. Pretty soon they will be telling you to get your third or booster. Kids, unvaccinated, vaccinated are all passing the virus, and they were before as well. It is not going away. What are you specifically worried about for me?
There is clear medical and scientific evidence that getting vaccinated reduces the severity of the outcome if you get COVID. The flip side is also true. Unvaccinated people are clogging up hospitals, taking up valuable, scarce medical resources, resulting in cancellation of other medical procedures, and resulting in unnecessary loss of life. The medical evidence is also very clear that vaccinated people are less likely to spread the virus as they have a lower chance of getting the virus once immunized. Did you get your kids immunized for measles and smallpox? Or did you ever get a shot for yellow fever or hepatitis to travel? If you did, you knew then there was risk to getting vaccinated, but you did it anyway because the benefits outweighed the risk and you helped to slow or stop the spread of dangerous diseases. The medical evidence is also very clear that the risks to a healthy individual of getting vaccinated are extremely low and rare. If you are healthy and if you are medically able to get the vaccine and choose not to, I think society in general is willing to accept that and respect an individual's right to not get vaccinated. However, I also believe the majority of society believes that an individual who voluntarily chooses to not be vaccinated should not be afforded the same rights and freedoms to move around in and enter public spaces, as that places others at risk for what is your personal choice. Is it your choice? Yes.
Interesting that is has become such an us and them issue for you. Also, please make sure that my brother, the doctor, dispenses the all the correct medical evidence as well. The vaccinated can get and carry the virus just as easily, but they may not get as severe symptoms, just like other coronaviruses. Anyways, everything you do affects someone else. Please read what you wrote. The majority of society believes that an individual who voluntarily chooses to not be vaccinated should not be afforded the same rights and freedoms to move around in and enter public spaces, as that places others at risk for what is your personal choice. If you added for a disease that unalives the majority of the population, I would agree if you leave it as it is, or you replace not be vaccinated with something else like drink, smoke, do drugs, hang glide, fly a plane, have unprotected sex, pollute, or drive a motorcycle. I would not agree. Hopefully, you can see the difference and are enough of a critical thinker to question yourself and others. I am okay to question myself.
COVID is a severe disease. Cast your mind back to New York at the beginning of the pandemic before the vaccine. The hospital system was overwhelmed and they were hauling unalived people out by the truckload. How can you even compare COVID to hang gliding or riding a motorcycle? The vaccines have severely curtailed the passing rate. I can't change how society views your position on this and what restrictions society will demand from the unvaccinated. It is what it is, just as it is your choice.
I am not comparing COVID to riding a motorcycle. You do not get the point. So change my mind. What is my risk of passing of this? Don't tell me lots or use a scary story.
I don't know what your personal chance risk is of passing from COVID, and I don't think the medical community can tell you either. You have to get COVID to find that out. Google mortality risk COVID 19, and you will see there are many different measures of mortality risk. There is a great deal of data quantifying the various passing rates broken down by country and by time period. The passing rate is constantly changing. Don't ask me, do your own research.
I did my research. That is why I am asking you so that you can steer me in the right direction. If you say you don't know the numbers and you say that the medical community does not either, where are you getting your information from?
You asked me to estimate your risk from passing, and I explained that it is not possible for me or the medical community to estimate any one individual's risk of passing from the disease. How can I make that any clearer? There is an immense amount of data available on unalive rates from COVID broken down by age and country and time period. Why don't you Google it and educate yourself?
You know how old I am and where I live, and you say there is an immense amount of data. Okay, what is my risk? Change my mind. You keep telling me that there is a risk, but I don't think you have actually looked at this data yourself. I have already looked, and the risk is very, very low. Maybe I am wrong, and you can save my life.
Your level of what constitutes low risk and what someone else deems low risk are always going to be wildly different. I guess you are one of the 5 to 10% of the population who believes it will not happen to you, so regardless of what the facts are, you are going to take the position your risk is low, rightly or wrongly, so there is no point even discussing that with you. More importantly, what you have demonstrated through demanding to focus solely on your personal risk is, versus engaging in an open and honest discussion about whether you, I, and others getting the vaccine mitigates the risk of the population as a whole, indicates that all you are considering is you and not others around you or who you might come into contact with. I say it again. It's fine if you and others take that approach, but don't expect the society as a whole to welcome you in with open arms.
What is wildly different? What is not open and honest about my discussions? The CDC in many countries have documented the general and specific risk. Current passing worldwide are 626 per 1 million of population. That is 0.00062%. If I am wrong, please correct me. Please don't give a morality lesson. Just explain to me how I am incorrect. I am challenging you to help me. To put that in perspective, the WHO says that the unaliving rate of contagious hepatitis A is from 0.3% to 0.6% for all ages and up to 1.8% among adults age 50 years or older.
Of the approx 1.6 million people who have gotten COVID in Canada, approx 2% unalived. 7% of the people who got COVID were hospitalized. Vaccines appear to be working as 83% of the people currently being admitted to hospital are unvaccinated people, despite the unvaccinated making up approx 20% of the population. Of the current cases that are hospitalized, the passing rate is higher amongst the unvaccinated group. Thus, it is clear to me that the passing rate would have been even higher to date in Canada for those who got COVID, if not for the vaccine. What I hear you saying is that you do not think COVID is a serious disease and that you do not care about mitigating the risk to the population because you don't think you will get it. I guess you may end up being the guy struggling in the dangerous water without a life jacket who did not heed the warning signs about dangerous water and end up pulling the others down who are wearing life jackets.
Nice. Wait, BTW, your 2% is actually 1.67% if you do the math. You are talking about a percent of reported COVID cases. My 0.006% number I gave you is for the entire population. From your data, The Canadian 28,289 unalive people out of 36 million means a rate of 0.0007%, which is the same as my number worldwide. So we can agree on that number. Showing unalives from reported cases does not show the reality, as so many of us have had COVID and not reported. I did percent of cases or percent of population, or regardless, those numbers should make you question your need to shame and force me into sticking something I don't need into my body. Mitigating the risk to the population is a nice soundbite, but the reality is that we all make the choices, the work for our immediate circle. I know you do as well. Anyways, since we agree in the numbers, what number do you think is low enough to be considered a number where you don't have to put me in jail for not following the group?
What you fail to understand is that the numbers take into account that 80% of the population has been vaccinated, reducing the unaliving rate, and severe restrictions were placed on gatherings to mitigate spread of the disease. Without mass vaccinations and the restrictions, I think it is pretty obvious that many more would have passed, as our hospital system would have been overwhelmed. Some jurisdictions are still on the brink of having their hospitals overwhelmed due to COVID cases, which is putting others at risk who need hospital services. And look who's filling up the hospitals with COVID. It's largely the unvaccinated. So when you say, look at how few have passed, it is really not that bad. You are conveniently forgetting that the reason the passing rate is lower is that most people have already been vaccinated. I am not shaming you. I just don't understand why someone I consider quite smart is downplaying the severity of the disease and can't quite grasp how important it has been that the majority of people have been vaccinated in the management of this disease and to allow our healthcare system to cope. I do care about you and your family. That is why I thought I should poke you a bit about getting vaccinated. However, I don't think I can add any more to the conversation, as we clearly have a different perspective on how a society should function, and I don't want it to be another factor in our already fractured relationship due to earlier events. Thanks for sharing your thoughts, and I truly hope that you stay safe.
You asked on how vaccinated can spread COVID, especially variants. Like the cold, another coronavirus, I suspect that eventually it will just get to a circulation saturation mutation point where virus has realized the most effective spreadability and then stabilize. At that point, we will live with it circulating among us forever like the cold. Unfortunately, it may have more severe symptoms than the cold for people for a few generations. I bet you $1 that they will tell you soon that you need a booster every 6 months to a year. The drug companies will have no problem pushing this on the uneducated politicians who look good promoting it. That's what I would do if I ran a vaccine drug company: keep the product in demand. Highly vaccinated Israel is seeing a dramatic surge in new COVID cases. It is already starting here. See News Today here about outbreaks in long term care facilities and regular folk again. Get ready to get injected every 6 months.
As the percent of population that is fully vaccinated grows and the percent of unvaccinated contracts, the ratio of vaccinated to unvaccinated people ending up in hospital or getting sick is bound to grow.
My discussion with you is not to show that a vaccine does not reduce risk. My discussion has always been that the risk of serious complications is so low that it does not warrant the vaccine mandates. The reason for the mandate is not to protect the vaccinated, it is to incentive the unvaccinated. Look at the outbreaks now again in long term care in BC. These are not unvaccinated people, yet there are again large numbers of passing and sickness. Instead of focusing on the vulnerable and spending time, money to come up with a way to protect them, the government is trying to vaccinate children who, even if they get COVID, will hardly notice it. Pushing me to get vaccinated not only does not protect me, since I already had it and my risk of complications is about 7%, but it does not protect the vaccinated who most think that they cannot spread COVID. Ask yourself why the Canadian government is refusing to stop requiring a negative COVID test for those already vaccinated returning to Canada. Everyone is upset about that, does not understand why they have to pay to get that done. Well, they do not you understand that the scientists know that these vaccinated travelers will bring variants back to Canada even though they are vaccinated. I have no illusions that COVID is not going to continue to circulate and mutate in our population. Focus on the vulnerable, not the rest.
To protect the vulnerable, you have to stop the transmission of the disease. Yeah, I get it. You think your risk is low, but the more vaccinated, the less spread, as the vaccinated are not getting it to the same extent as the unvaccinated. So get vaccinated and protect the vulnerable. That is what I and all the medical community have been saying from the beginning and still are.
Yes, that is the entire premise. How much of your life are you willing to change to protect a smaller group? If you say none, you sound like you are heartless. If you say everything, then you are willing to give up all your freedoms to attempt to protect a few. The medical community is not concerned with freedoms, so understandably, they will not consider that when making recommendations. Of course, it sounds safe and scientific to give everyone a drug to solve the problem, but is it really necessary? Before vaccinations, numbers were going down. What happened? Vaccinations?
There was never any dispute that COVID was or is something that will continue to circulate and recirculate in various forms. Without mass vaccinations, our hospital and medical system would have been, and still is, at risk of being overwhelmed with people, both vulnerable and non vulnerable, needing critical care. When that happens, not only do people pass from COVID, they pass from appendicitis, workplace accidents, childbirth, etc., because they can't get access to emergency services. So you are basically saying, yeah, I told you vaccinations are a waste of time. Look, COVID is still here and it is still infecting people, vaccinated or not. That is not the point of debate. The point of the debate is, have vaccinations saved lives in a major way? To consider that, I ask you one simple question, knowing that there is overwhelming scientific evidence that vaccinations reduce the severity of the disease and passing rates. Go back and envision a world where no vaccines were taken or available and are still not available. Do you think our medical system would have been or would currently be overwhelmed?
The point of the debate has never been about the theory of vaccines. My entire conversation has only been about this particular virus and the response and issues around that. Look back at everything I said. I told you I am not anti vaccine. BTW, you actually did tell me earlier that vaccinated people do not spread the virus. Look back. Listen to the government today, where they tell you in one breath that they are limiting numbers and increasing restrictions. And then in the other, telling you the best way to prevent spread is to get vaccinated. You are no more protected than me after all this time. Even worse, the virus has mutated among the vaccinated. So again, was the response and loss of freedom worth it? No? To answer your question, the focus should have been on the immunocompromised and those that wanted a vaccine. Spend the money over the last 2 years to increase the hospital capacity to handle increased cases. You know why they didn't? Because it was a simpler and faster decision to spend on a vaccine, and the vaccine companies pushed it. So now the medical facilities are still the same, and we have a vaccine that does not really work after spending all that money. Those that are concerned or afraid should certainly take the precautions and vaccine if they need it. Instead, we have adults fearing for their lives trying to vaccinate children who have almost 0% chance of even knowing they have this virus. Get your tetanus and polio vaccination, but not this one if you don't want it. How about this restriction that the government has put out? Households can have 10 guests if they are all vaccinated and only 5 guests if they are not all vaccinated. This is a perfect example of how politicians are protecting you. So let me ask you this question. If our families had a get together, who should be most concerned for their own safety, the vaccinated or the unvaccinated?